First of all, we have to think how we can prepare patients for surgery, for chemotherapy, for immunotherapy. And I suggest that we use like a priming concept. Priming, what means pain management, R for cardiovascular assessment, to define the interval until I start the medical intervention. M for medical information, because very few women knows what is the risk of endometrial cancer, what are the treatment strategies, and even to look on the interaction with the other polypharmacists, because many of the women have 5, 6, 7 drugs, but nobody take care how they interact, and even many of the women are undertreated or overtreated, so they need a drug clearing. And this is the other I of the word priming, and nutrition lifestyle. So we know that obesity is one of the key elements in developing endometrial cancer, but even it is a risk factor for the recurrence. And we have to act patients to change maybe the lifestyles. Not easy, but we know. And the G of the word priming is guidance, psychological support, and to empower the woman to get second opinion, to ask for clinical trials. And we know that the structure for the advocacy groups is different than we know for breast cancer, but even to decrease the barrier that patient can share their individual experience with other women, this is something what I really support. So this is the prehabilitation aspect of trying to improve the healthcare status of the patient before they go to the individual medical intervention. This is one topic. The second is how we can really change the cancer care program, because we know from many surveys and even in our study that this is not really systematically addressed. And we have to talk about these items, lifestyle, we have to talk about genetic, think about Lynch syndrome or other genetic risk disorders. And we have to talk how we can follow up the patients if they have really a higher risk for heart attacks. So how we can use maybe digital applications to improve the interaction of the different health professionals. And I think this is something what we even have to underline. And we know that women with endometrial cancer are many of them long-term survivor. But what's about her bone health or the mental health? So long-term survivorship, especially for endometrial cancer patients, I think is crucial. So these are topics what I think we have to change the classical system. And I'm very proud that we see so much dynamic, but we have to empower and to change even our classical traditional behavior.